And today we will talk about all the ways that science has taught us we can slow or even reverse hair loss. We have to talk about dutasteride. Dutasteride is yet another molecule similar to finasteride, but remember those three isoforms of the 5-alpha reductase enzyme? Well, it inhibits all three, mainly type 1 and type 2, but also type 3, and it does it very potently.
So that's true. So there's finasteride and there's dutasteride, similar compounds. Finasteride is a selective 5-alpha reductase type 2 inhibitor, so it only inhibits the type 2 5-alpha reductase enzyme, which is mainly seen in the hair follicles and seen in the prostate. So we use it for hair loss, and the higher dosage of finasteride may be prescribed by a urologist for men with enlarged prostates. So the lower dosage, the 1 milligram finasteride, is for the hair. The 5 milligram finasteride may be prescribed by a urologist for enlarged prostate. Dutasteride is what's referred to as a non-selective 5-alpha reductase inhibitor. So it can be more potent. However, it could affect other parts of the body, and there's likely a higher risk of side effects. While there is a small risk of side effects with finasteride, the risk with dutasteride is probably slightly higher. Finasteride is FDA approved in the United States for hair loss. Dutasteride, if that is being used for hair loss, is off-label.
So as a consequence, the typical dosage of oral dutasteride, get this, 0.5 milligrams to 2.5 milligrams taken orally, works 2 to 5 times faster than typical finasteride at inducing hair regrowth, and reduces DHT by, get this, 95%. So it just near flatlines DHT. And that can occur at concentrations as low as 0.5 milligrams, although you will see prescriptions and people taking dutasteride anywhere from 0.5 milligrams all the way to 2.5 milligrams orally. Now, not surprisingly, dutasteride is associated with a lot of side effects related to the DHT pathway. So
usually people that take dutasteride orally start off with a low dose, such as the 0.5 milligrams, which can be effective. Dutasteride can also be applied topically, so it may be combined in a compounded topical treatment. Sometimes people do what's called mesotherapy, which is small little injections of dutasteride as well in the scalp. So that can be effective as well. So just something to keep in mind.
Things like reduction in sex drive, reduction in overall drive. It also tends to impact other hormone pathways, so increases in estrogen, prolactin. That's why gynecomastia, growth of male breast tissue, sometimes occurs when people take dutasteride. And so you're probably asking, why would anyone take dutasteride? Why not just take finasteride and wait for that hair growth? Well, the answer is that people are often very impatient, and it turns out that dutasteride works about 2 to 5 times faster than finasteride. So some people don't want to wait a full 30 weeks or 40 weeks or 50 weeks or more in order to grow their hair back. And they're very concerned about the hair loss that's occurring. So they will take what I hope would be a very low dose of dutasteride. I realize that there are ways to take dutasteride that can be safer, offset some of these side effects. But by my read of the literature, if one is going to try to mildly inhibit the DHT pathway, things like saw palmetto, things like topical caffeine, which has some effect on the androgen pathway, but as we talked about earlier.
So there are the botanical products such as saw palmetto, which may have some inhibition of 5-alpha reductase as well. It's not going to be as effective as finasteride, which once again is FDA approved. Dutasteride, from what I've seen, is more so people who have been on finasteride for a long period of time. They've been on it for years and may not be working as well anymore because it does lose some effectiveness over time if you've been on it for years. Sometimes those people will switch over to dutasteride to get more of an effect for limiting hair loss, thickening hair, and having those benefits. So they'll switch over. Finasteride is not working as well. It's not as many people are impatient or they're not willing to wait the time with finasteride because, it takes months to see the thickening, and finasteride can help to do that. And the dutasteride, while it may be slightly quicker, it's more so people that finasteride may not be working as well for them, and they want to switch to something different in the same general category.
Things like ketoconazole, mild reduction in androgen receptor pathways in the follicle, and very direct because it's applied directly to the scalp. Things like that are going to be the best route for mild reductions in DHT as an attempt to maintain hair or grow hair. Whereas if one really wants a potent stimulus for increasing hair growth, that's very likely going to be finasteride, and hopefully low enough dosages of finasteride, and hopefully a person that they are willing to wait the duration of time required for that hair growth to come back, because they understand that that anagen phase takes some time. Now, the holy grail of all this hair stuff is in understanding that no one specific treatment is magic. And in fact, there are now a number of good meta-analyses comparing the various treatments we've talked about today alone or in combination. And we can summarize that pretty easily by saying that combination treatments that involve a mechanical stimulus and a chemical stimulus.
So, that's just going on to the delivery methods and whether you do microneedling combined with a topical treatment or the topical treatment by itself, or whether a topical treatment is compounded with an ingredient such as tretinoin that may help the medication penetrate a little bit deeper into the scalp. All those things may help in terms of the efficacy of the treatment. But once again, in my opinion, finasteride has been around for a long time. It's been FDA approved for many years. There is a risk of side effects, which is something to discuss with your physician. So you need to know about the potential risk of side effects before starting the medication. So that's all in the discussion before a prescription is written. But I would recommend more so if you're a candidate for finasteride, and if your physician deems that you're a candidate and you're aware of the potential side effects, to start with that medication. Dutasteride, once again, it's an off-label medication. It's not FDA approved. It can be effective and it can be very effective, but you just have to realize that it may cause some additional side effects and may not be the best way to start. So it's a discussion, both medications you can have with your doctor, your hair loss specialist before starting any medications, to be fully aware of everything. But in my practice, we prescribe finasteride if someone's a candidate and someone's aware of this potential side effects. Also minoxidil I combine that with, whether it's oral or topical minoxidil, which can be effective. And I also like to combine the medical treatments with PRP, platelet-rich plasma injections. I think all three of those treatments work by different mechanisms, different pathways, and they all can be quite effective. So that's something to keep in mind when you're treating hair loss with the available medical treatments.